Welcome to the next topic for the staff orientation lecture regarding specimen collection. Blood is the most frequent body fluid used for analytical purposes. The following are to be considered before blood specimen collection. Consultants, resident and fellow trainees, are the only authorized personnel to order for laboratory investigations in the hospital. All specimen collection will require the patient to have an ID bracelet. Specimen collection will be performed by phlebotomist, nursing personnel or other allied health member trained for this task. The person who collects the sample physically must be the same person who collects the sample in quadrant system and print label. The staff collecting the sample shall ensure that specimens are obtained in accordance with clinical requirements and appropriate time specifications. In times of shutdown, some physicians' orders come in a handwritten. Regarding patients' blood volumes, the amount of blood that is supposed to be drawn at one time, day, week, or month, should be determined in order not to compromise the patient's health. As a rule of thumb, no more than 3 to 5% of a patient's blood volume should be drawn in one day. Therefore, the collector is highly advised to go for microtainer collections from babies and pediatric age group. Blood volume varies with the age of the patient. Check the details that is shown on how much blood in milliliters is present per kilogram of body weight per patient age. In specimen labeling, every collected sample, whether from the inpatient's wards, in ER, must possess an identification label that cite the following parameters: patient's full name and medical record number, patient's age and gender, patient's location, collection date and time, the collector's initials and ID number. Sample type. The collected specimens must be packed properly in a Ziploc biohazard bag. All specimens should be received in transporting ice box, and the temperature of the box should be monitored by the nurse and lab reception in charge. Prior to any specimen collection, the patient must be identified using two identifiers: patient name, medical record number, national ID for Saudi citizen, or IQAMA ID for non-Saudi. Refer to the hospital policy and procedure regarding patient identification. The patient's identity should be verified by asking the patient's name and age when it is practical to do so. The identifying barcoded label must be attached to the primary specimen container after specimen collection, and not deferred until a later time. Venipuncture is a device used for an accomplished blood extraction, with needles attached to plastic tube with predefined vacuum for exact draw volume. The system makes possible direct sampling from vein economically and efficiently. Equipment required for venous puncture procedures. Be sure that the following are readily accessible before performing venipuncture. All necessary tubes identified for size, draw, and additives. Labels for positive identification of samples. Blood collection needles and holders, gauze, swabs, sterile gauze, dry sterile gauze, tourniquet, adhesive bandage. Wear gloves during venipuncture and when handling blood collection tubes to minimize exposure hazards. Verify computer-printed labels. Identify patient. Ask conscious patient her whole name. If fasting is required, confirm that fasting order has been followed. Reassure patient to avoid as much tension as possible. Select suitable vein for puncture. Apply tourniquet. Vein of the antecubital fossa, median cubital, cephalic vein are preferred. Remember, never draw blood in arm with intravenous line. Clean the site with 70% alcohol. Begin at the puncture site in circular motion into out and allow area to dry. Anchor the vein firmly, both above and below the puncture site. Use either thumb and middle finger, or thumb toward. Do not touch the swabbed area, and index finger. Enter the skin with needle approximately 15 degrees angle, to the arm with the bevel of the needle up. Follow the geography of the vein with the needle. Insert the needle fairly fast. Do not bury the needle. When using a syringe, pull back on the barrel with a slow even tension, as blood flows into the syringe. Do not pull back too quickly, to avoid hemolyzing the blood, and collapsing the vein. If using the vacutainer, as soon as the needle is in the vein, ease tube forward in the holder as far as it will go. At the same time hold the needle in place. When the tube is filled, remove it by grasping the end of tube, and pull gently. Remember not to use tube, if foreign matter is present. Transferring a sample from a syringe to a tube is not recommended. Additional manipulation of sharps increases the potential for needle stick injury. In addition, depressing the syringe plunger during transfer can create a positive pressure, forcefully displacing the stopper and sample and causing a potential blood exposure. Using syringe for blood transfer may also cause over or underfilling of tube, resulting in an incorrect blood to additive ratio, and potentially incorrect analysis result. Remember not to use tube after expiration date, or tubes with liquid preservatives, and anticoagulants are clear and colorless. Release tourniquet, when blood begins to flow, after all blood has been drawn. Have the patient relax his fist. Do not allow the patient to pump the hand. Place a dry sterile cotton ball lightly over the site, and withdraw the needle, then apply pressure over site. Handle all biological samples, and sharps according to hospital policies and procedures. Obtained appropriate medical attention in case of exposure to biological samples, such as puncture injury, since they may transmit HIV, hepatitis and other blood-borne diseases. Discard all blood collection sharps in biohazard containers. Oral glucose tolerance test is a laboratory test that measures the body's ability to metabolize glucose after drinking a high glucose drink. The test aids in the diagnosis of diabetes mellitus, gestational diabetes mellitus, impaired glucose tolerance, and renal or elementary glycosuria. GTT procedures. The physician orders an oral GTT into the quadrant system. The physician instructs the patient to maintain a normal diet with a carbohydrate intake of 150 grams per day for 3 days, before the scheduled appointment, and fast for 6 to 8 hours, for gestational, adult, or child GTT tests. For 50 grams glucose test, screening for gestational diabetes mellitus, glucose load is given irrespective of the time of the last meal. Ensure that all equipment is close at hand before starting the test. Collect the sample following the same venipuncture procedure. Send patient sample to chemistry lab for fasting blood sugar test. If the FBS result is higher than 140 milligrams, the nurse shall contact the requesting physician or the pathologist for further instructions. Do not continue with the procedure until further instructions are given. The objectives for the blood culture collection are to provide instructions for sterile collection of blood samples for aerobic and anaerobic fungal and acid bacillus blood cultures. Ensure that blood cultures are taken using the standard accepted technique, advocated by evidence-based best practice guidelines. Reduce inappropriate sampling and the likelihood of blood culture contamination occurring by improving blood collection practice. The following are to be considered before doing blood culture. Blood cultures shall only be collected by members of qualified staffs in medical, nursing, phlebotomist, or technician, trained in the collection procedure, and whose competence in blood culture collection has been assessed and maintained. If blood is being collected for other tests, always collect the blood culture sample first. Only take blood for culture when there is a clinical need to do so, and not as routine. Blood cultures shall be taken after clinical identification of possible bacteremia or sepsis, and before the administration of antibiotics. If a patient is on antibiotics, blood cultures shall be taken immediately before the next dose, with the exception of pediatric patients. Do not use existing peripheral lines to obtain blood cultures. The nurse should take into consideration the following blood culture procedures. Determine the type of blood culture vials to be utilized. If necessary, discuss timing of cultures, sites, need for any special instructions, with the ordering physician. Indicate site from which blood was collected, using comment section. Explain the procedure to patient, and its significance for medical management. Verify 2 patient identifiers, by checking name, identification wristband number, prior to blood extraction. Selection of blood culture vials. If patient is not on antibiotics, a routine culture set consists of a standard aerobic, and an aerobic without charcoal culture bottle, if patient is on IV or antibiotics, or has been off antibiotics for less than 24 hours, or for suspected fastidious organisms, a charcoal aerobic, and an aerobic may be substituted for the standard aerobic, and an aerobic culture vial. Procedure cart has to be decontaminated and cleaned with Sanicloth 70 prior to use, and shall contain the following items: tourniquet, sterile gauze, skin disinfectant BD Persist Plus, Providon iodine prep 70% alcohol prep swab, surgical sterile gloves box safety lock blood collection set, Vacutainer blood collection set, protective personal equipment, disposable yellow gown, sterile gloves and mask, sterile gauze sponge packets, sterile band-aids or plaster tape, and sterile syringes. Clean any visibly soiled skin on the patient with soap and water, then dry. Apply disposable tourniquet, and wear non-sterile gloves. Palpate for a vein, and select an appropriate site for venipuncture. Loosen tourniquet and keep in place. Scrub skin back and forth for 30 seconds with BD Persist Plus or Persist, Providon iodine. Prep skin 3 times with the supplied applicators, and allow skin to dry for 30 seconds after each scrub. Clean skin with 70% isopropyl once, and allow to dry for 30 seconds. Do not repalpate skin following cleaning. Clean hands again using correct hand hygiene technique. Follow the 5 moments of hand hygiene. Open the sterile glove package on the flat surface of the cart, without touching the inside. This is your sterile surface. Open syringes, needles, and transfer devices, then drop them out of the packages onto the sterile surface without touching them. Place any tubes and supplies needed for other lab draws next to the sterile surface. Apply tourniquet again. Apply surgical sterile gloves. Perform venipuncture without repalpating the intended puncture site after cleaning. Collect sample and release tourniquet. Cover the puncture site with an appropriate dressing. Inoculate the blood culture bottles first if blood is being collected for other tests. Inoculate blood into an aerobic culture bottle first. Do not change the needle between sample collection and inoculation. Label culture bottles with patient's name and medical record number. Use electronic label. Do not place label over bottle barcoded area of the bottle. Nursing personnel should be aware about complications and special considerations in blood collection, such as fainting, hematomas, decay, edema, skin peeling, damaged, sclerotic or blocked veins, hemolysis. Remember the following examples of improper phlebotomy techniques that can cause hemolysis: using needle that is too small, pulling a syringe plunger back too fast, expelling the blood vigorously into a tube, shaking or mixing vigorously. Appropriate handling can prevent problems due to improper phlebotomy techniques. Thank you, and I hope you learn the different proper ways of collecting specimen samples to patients, and you will apply the safe practice in the nursing units. To avoid rejection, hemolysis, and contamination of specimen samples,